Welcome to the Bill Walton Show, featuring conversations with leaders, entrepreneurs, artists, and thinkers. Fresh perspectives on money, culture, politics, and human flourishing. Interesting people, interesting things.
Welcome to the Bill Walton Show. I'm Bill Walton. In the United States District Court for the Eastern District of Virginia, a civil action, Professor Todd Zywicki, plaintiff, versus defendants Gregory Washington in his official capacity as president of George Mason University and all the individuals of the George Mason University Board of Rectors in their official capacity. So what's at stake? On June 28, 2021, George Mason University announced a reopening policy related to the COVID-19 for the fall 2021 semester. The policy requires all unvaccinated and staff members, including those who can demonstrate natural immunity from prior COVID-19 infections, to wear masks on campus, physically distance, and undergo frequent COVID-19 testing. Professor Zywicki respectfully believes the policy violates both his constitutional and federal statutory rights. Hence the lawsuit. Todd, welcome back, my warrior friend. It's good to see you.
Thanks, Bill.
Todd Zywicki, I've introduced him before in this show. He's a GMU Foundation Professor of Law, mouthful. GMU Foundation Professor of Law at the Antonin Scalia Law School. He's been with GMU over 20 years, except for occasional service as a visiting professor at other law schools and high-level service in the U.S. government. He's one of the law school's most frequently cited and influential scholars, and has been serving the community and the university his entire time there. Representing Todd in the case is Jenin Younes, Litigation Counsel for the New Civil Liberties Alliance, a nonprofit, nonpartisan civil rights group founded to protect our constitutional freedoms from violations by the administrative state. She's a graduate of NYU Law School and Cornell University. Todd, Jenin, thrilled you guys are here, and I'm glad you're doing what you're doing. But Todd, you're suing your employer.
That's right,
now,
Bill.
Tell us what led you to that.
Well, I didn't want to sue my employer, Bill, but and in fact, after I first reached out to the NCLA, we contacted George Mason. We sent them a long letter explaining this issue. We attached medical affidavits, and they didn't listen. And instead of responding to our letter, they basically the next day they rushed out this policy. And sometime after that, they deigned to actually respond to us. And in the letter, what we did was we basically provided the proof. And let me make clear, in this case, we're not questioning, in this case, whether or not George Mason or any university has the right to or the power to take reasonable precautions against what they consider to be necessary to prevent spread of infectious disease, in this case at least. But what we're saying is, if you're going to do that, it has to make sense, and it has to be consistent with the Constitution. So the letter we sent them said that I have natural immunity. I can prove it through antibodies tests, that my immunologist filed an affidavit where he says that my immunity level is antibodies level is comparable to somebody who's been vaccinated. And then we filed an affidavit with two very leading and notable scholars who I'm sure you know of, Bill, Jay Bhattacharya from Stanford Medical School and the great Martin Kulldorff from Harvard Medical School.
They were both doing the Barrington Statement,
and
right?
They did exactly. And they provided an affidavit in support that provided all the evidence that shows that natural immunity is at least as protective as a vaccination, and more protective than some of the less effective vaccines, such as the Johnson & Johnson vaccine. And what really turned my head, Bill, and really kind of made me kind of drop my jaw was the George Mason policy didn't just provide protection for the normal vaccines, right? The ones that had emergency approval from the FDA. The George Mason policy approved of any vaccine that was approved by the World Health Organization. So they included vaccines like the Chinese vaccines, like Sinovac and Sinopharm, but not natural immunity. Is how far this obsession with vaccination, rather than looking at actual levels of immunity and what the protection is.
Jenin, didn't the university lawyer tell you something about natural immunity? That what?
That in their opinion, natural immunity doesn't exist. That's their position.
That's their position, and they're sticking to it.
Yeah, and they're sticking to it.
So how do these people arrive at something like declaring that natural immunity, which has been part of the accepted wisdom about viruses for, well over almost a century?
I have no idea. And it's not only, accepted for well over a century, generally speaking, but it's established for this virus, as Bhattacharya and Kuhldorff established. We actually estimate the length of vaccine immunity based on what we know about natural immunity. So there's simply no question that natural immunity provides robust and durable protection. And actually, Professor Zywicki he didn't just know he had COVID and suspect that he had the antibodies. He has gotten repeated antibody tests that established as recently as, I think, June, that he has extremely high levels of antibodies.
Well, didn't we have this notion that there was herd immunity, and then when we reached some number, I think Fauci even talked about this, we reached to some number, then we could just relax and live our lives. That somehow the notion of herd immunity seems to have dropped out of the public discourse.
Yeah, the contribution to that, at some point they officially changed the definition. The definition said via vaccine, which obviously now we're learning because of all these breakthrough infections, we can't actually vaccinate ourselves to herd immunity. But they said through vaccination or natural immunity. And at some point they dropped that out. And one of the things that's so bizarre about this bill is you could think about a statement like there is no natural immunity. It's like, how do they think the vaccines work? Yeah. I mean, it's basically the way to think about this bill is it's like what the vaccines are designed to do is mimic the natural immune system, right? They try to generate a response that is like what the natural immune system is. Do you know how they determined whether or not the vaccines worked originally? They drew blood from people like me, and then they saw whether or not it neutralized the virus the same way that the vaccine neutralized the virus, like my blood did. My blood was the answer key for which they were trying to see whether or not the vaccine could replicate it. And now they're denying that there's any such thing as natural immunity or that's robust or it's durable or anything else. It's
so
crazy.
Let's solve to this answer, and what you had was the answer.
Exactly.
When did you get COVID?
So I was one of the unlucky winners of the COVID lottery. I first got it in March 2020. Yeah. At the time, I was not able to get a test because they were so scarce. But when it came back time to teach last fall, not this year, but last fall in 2020, on July 2020, I thought I wanted to volunteer to teach in person because I felt I owed it to my students to teach in person if I could. While a lot of the other, I'm in my 50s, Bill, right? I could have easily taken a pass and taught virtually, but I felt like I owed it to my students. While a lot of my younger colleagues around the university went off to their vacation homes and whatnot. But what I thought was, I want to make sure I'm safe and that the students are safe. I believe in natural immunity. I got my first antibodies test in July 2020. The point is, Bill, I put my money where my mouth is, right? Which is early on, the science was compelling. Natural immunity is real. Natural immunity is powerful. And so I got an antibodies test when I was convinced that I was safe. Even though I was in my 50s, volunteered to teach in person. And I taught all last year in person, 3 sections of first year contracts. And now it's just absurd at this point to think that it doesn't work.
So tell me about your organization. How did you guys get to be representing Todd in this case?
So my organization called the New Civil Liberties Alliance has been doing a lot of COVID-related litigation against some of the restrictions. So I joined them in April for that reason, because I was very interested in fighting what I saw as massive government overreach in these areas. And a mutual acquaintance, Phil Magnus, actually introduced us.
Yeah, we've had Phil. Phil's been on talking about, well, actually, we talked about 1619 last time. We talked about COVID with him.
Yeah, I knew him from AIER, and he connected us. I think he knew I was interested in doing vaccine mandate cases.
So you started out on the left.
Yeah.
You were a public defender.
Yes, in New York City, which is about as far left as it gets.
But then the civil liberties issue that affect individuals, you came to see affects, I mean, it's affecting,
Yeah. So
not just indigent criminals, but all of us.
Exactly. So I had always sort of parted ways when it came to First Amendment issues. For instance, a lot of the campus speech stuff and a lot of the cancel culture stuff I disagreed with my peers about. But when COVID hit and I saw, the government telling people they can't leave their homes, they can't run their businesses, they can't send their kids to school, and the left thought this was just fine. Everyone around me thought there's no problem with this, and I was like, this is crazy. I mean, these are, and it's also indefinite. We're not talking about 2 weeks here. This is going on, and I mean, people want to bring it back on the left now. They're all talking about staying home.
Naomi Wolf also,
Yeah.
obviously on the left. She's
Yeah.
now making common cause on this
Yeah.
one.
Yeah. She's a good friend. I actually just had dinner with her last night. So we've
So yeah, I mean, you probably had a lot to talk about. So where are we with the case? I guess they announced this policy last month. And
Since that time, just recently, they brought back restrictions on the vaccinated people, right? So as these vaccine breakthrough cases are multiplying around the country, what we're seeing is that they originally created two pretty clear
the
classes.
vaccinated or the unvaccinated?
They brought back new restrictions on the vaccinated. So originally they had
Wait,
Because
aren't we,
of the
aren't we
Delta
going in the wrong
variant.
direction
going in
here?
the wrong direction.
well, the Delta
That's right.
variant.
The Delta variant.
The Delta
That's
variant.
The Delta.
That's right. And so originally, as you described at the outset, they put a lot of burdens on me that they didn't put on people who could prove that they were vaccinated. I thought those burdens were not only stupid, but that they were interfering with my ability to do my job and teach my students. They were designed to stigmatize me by making me wear a mask when vaccinated people didn't. I was going to have difficulty teaching my students as well as faculty members who were more vaccinated and have to wear a mask. And so that was what bothered me. And that's what I thought it was a violation of my constitutional rights to disadvantage me on this completely arbitrary ground, to interfere with my ability to serve my students, and to stigmatize me and to basically hold potential adverse career consequences over me as a result of not being willing to take the vaccine, not being willing to be forced into taking the vaccine. And so I felt like they were trying to coerce me into doing that. And I've talked to my colleagues, and my colleagues who did, a lot of them didn't want to take the vaccine, including at least one who had natural immunity. He ended up doing it anyway, simply because he was concerned about the consequences if he didn't. So I was willing to fight it.
So you're you're watching the Bill Walton show, and I'm here with Todd Zywicki and Jenin Younes. We're talking about his lawsuit against his employer, the George Mason University, and their mandates about vaccines and the restrictions on both the vaccinated and unvaccinated, and those who've had it, had the disease. I'm wandering into uncharted territory for me. You filed in the United States District Court of the Eastern District of Virginia. Why did you pick that? Why'd you pick that court?
Well, that's the federal court where GMU is located, so that was the venue. The state claims we're raising are mostly federal claims, not state claims, or they are exclusively federal claims. So federal court made the most sense.
Okay, and where does it stand now? They've got what happens with this?
Well, so GMU granted Professor Zywicki's request for a medical exemption, not on the basis of his natural immunity. They refused to recognize that as a legitimate basis, but for a different reason, a sort of personal medical reason. So that changed the landscape because now he's not subject to disciplinary action, and because he's no longer sort of given this differential treatment with the masks, a lot of the issues went away
Where do we
with the
get?
granting of the exemption.
And you were involved with AIER. I think you were involved with the Great Barrington Statement.
Yeah,
And that declaration. And it was some highly credible scientists and medical professionals that came out on what the risks were and weren't. And I think they concluded that unless you were 70 or older, or had some comorbidity, or were like diabetes or were obese, that your risk of dying was something like 99, risk of survive, your chances of surviving were 99.45.
Under 70, it's 99.95% survival rate. And I think what the Great Barrington Declaration does, which so many people like Anthony Fauci and Leanna Wen and all of these other people don't do, is acknowledge the massive collateral consequences of these draconian approaches to COVID-19. On mental health, on people's education, socializing is important to people. We need to be able to hang out with each other, and that's part of being a human.
Well, there's the whole list of costs. There's
exactly.
The pro, which they presume, well, we're going to keep people safe from the virus, but the cons are enormous.
Cons are enormous.
Right.
And they don't even work because, people still have, it just sort of shifts the burden. The Zoom class can stay at home, but the essential workers are still out getting COVID. That's why they all got a lot of people who worked in kitchens and delivery people got COVID.
And that's what has been amazing to me, Bill, which is ever since this went big and I published my article in the Wall Street Journal, I've done a lot of other interviews and the like. And I have been hearing from people literally all over the world, but especially the stories from people around the country, right? This one cook, a Chilean immigrant cook who works in New York City, who got COVID this spring, and now his boss is going to fire him if he doesn't get the vaccine mandate, even though he's fully protected by natural immunity. You start going through the list of nurses. It's heartbreaking. The number of doctors I've heard from, Bill, is astounding. The number of doctors who say, I've had COVID. I got COVID treating people who had COVID. And now the bureaucrats, the HR bureaucrats who run my corporate medical center, the MBAs and the lawyers who really run this place are telling me I've got to get an unnecessary vaccine that exposes me to risk, right? It's all of this stuff is this one-size-fits-all policies. Yeah. My immunologist, whom on nurturism, he refers to it as algorithmic medicine is what the CDC has been pumping out. You gin up some, idiotic studies, and then you provide the same advice to everybody, regardless of their medical condition, regardless of how recently they've had COVID. And this is what Dr. Norchasm said to me, Bill. This is common sense, right? Which is you do not vaccinate somebody who concurrently or recently has had a disease. I had shingles, a virus. I had shingles this spring, a terrible case of shingles. If you recall, we had the
based on the symptoms, shingles are a lot worse than
that's
than
right.
COVID. Of course, you can.
If you recall, we had the delay the last time I was going to visit with you because I had this terrible case of shingles, and I got done with it, and I said to my doctor, "Should I get the shingles vaccine?" And he basically looked at me like, "How can somebody as stupid as you be a law professor?" And he's looking at me.
It's a different field,
Yeah, and he says, "Well, no, you don't vaccinate somebody right after they've had a disease because you risk hyperinflaming the immune system." He said, "Come over here. Here's your antibodies against shingles right here on my computer screen. Let's monitor this and see where you are in a few months, and then we'll talk about getting the shingles vaccine." COVID is a virus, Bill. It's a virus. The same rules apply that they always apply.
So we were doing some research this morning, kicking around. I think the number right now is only 52% of medical professionals have been vaccinated.
Yeah, something like that.
It's hovering right around half, and that means that half people don't think they ought to do it.
Yeah. I can't tell you, ever since we filed the lawsuit, I've had countless emails, and a lot of them from doctors and nurses saying, "I had COVID, I don't want to get the vaccine." And I'm the one who was serving my community during the worst of it, and now they're going to fire me because I don't want to get the vaccine.
Now, these were people who'd had COVID?
Well, most doctors and nurses had it because, by virtue of their profession. Right. So, and now, now a lot of the hospitals are saying everybody has to get the vaccines. There are a lot, especially nurses, I think, around the country who are just, writing me and saying, they're going to fire me. I was there. I was on the front lines working with COVID patients. I got COVID. Now I really don't want the vaccine, and now they're firing me. It's crazy.
Did any of them weigh in on whether they thought the masks worked?
Oh, I've heard from nurses and doctors about it. I personally don't think masks work. I've looked at it quite.
Well, you've done a lot of research.
Yeah. Yeah, I mean, they're stupid. If everybody wore N95s properly all the time, maybe they would work. Although I don't want to say that because I'm afraid the government's going to
mandate that.
Yeah,
these, these cloth masks and surgical masks with the gap here and people taking them on and off, and you have to walk into the restaurant and you wear it for 4 feet and then you take it off when you sit down. I mean, it's unbelievably stupid.
And this has real consequences, Bill, right?
Sure.
If you just take the mask, for example, there was this article a few weeks ago, you probably saw in the New York Times, about why people were unvaccinated. And there were literally people who were in the hospital who said, I decided, my doctor said I could get vaccinated, but I read all this stuff that said all I had to do was wear a mask every time I went out and I'd be protected from COVID. Right? They unfortunately believed the hype from the public health community that made them think like that a mask would be like protect them from any disease. And then they wonder why people don't get vaccinated when they tell them stuff like wear a mask and you'll be safe. It's
Jay Richards was on, and he had COVID as well.
Mm-hmm.
And I guess he went to the emergency room just because he had some other things that he thought might interrelate and wanted to be very careful. And so he's in the emergency room and he's noticing some people have masks and some people who are closer to the patients don't and whatever. And he's held up his little blue mask and he said, well, why aren't you wearing these? And they said, well, they don't work.
right.
So
Yeah.
we've got I'm interested in getting a little closure on where things stand with the lawsuit. Then I want to range a little more broadly